Thank you very much. A real privilege to be here today, and thank you for that generous and warm welcome, Alan. Today you've been hearing about ideas worth spreading, and thank you, Atul and Ian, for starting us off with such fantastic talks. I'd like to build on that talk, on that thought. If an idea is worth spreading, then perhaps that idea is worth implementing. But do we know how to implement those ideas reliably, consistently, nationally? I'd like to share with you 5 brief reflections, and through them I hope I can take you from the consulting room, the operating theatre, the simulation room that we've just heard about, and up to a system level, from the micro to the macro, from repeated, fantastic, small successes to reliably implemented national level change. On June the 12th, 2009, I was privileged to receive my Master's in Public Health from Atul, and I'm sure you remember handing that over, Atul. Atul and Dean Frank were very important on that day and throughout the training and the ideas they shared. Here's Atul, suitably dressed up for the occasion. I was disappointed not to see something similar today, Atul, but maybe later. One of the things that stuck in my mind was the address that Atul gave us at the end of that wonderful day. You reminded us, Atul, that as a population, as a group, we have generated huge knowledge, but not the capacity to deliver it reliably or equitably. And that closing that gap is the job of all of us, not just public health, but all of us. And it's an unfinished task, unfinished business that you can see elements of today and in this fantastic group of people gathered together, but it's an unfinished task here as it is around the world. Many of you have heard the fantastic ideas of Atul. Over 1.5 million people now have listened to the TED Talk that, if you haven't heard it, I'd highly recommend it. Atul, you challenged us that many of our behaviors date back to a time that is very different from now, when what was known could be known. And that was touched on again in Atul's talk, but I want to take that a bit further today. Every system is perfectly designed to get the results it gets. A friend of ours, Paul Bertolden, is attributed with that fantastic saying. It is so powerful and so pertinent to what we're discussing today. As Atul said earlier in his talk, we have trained, hired, rewarded people for certain attributes. Cowboys. Atul, you suggested that pit crews are the way forward. And I just wanted to expand that idea, with your permission, a little bit further, because I think as well as having pit crews for our patients, in our clinics, in our hospitals, in our communities, we actually need a pit crew for our health system. So I want to start thinking with you about what it would take if we all gathered around our health system. I believe that leaders tackle tough problems, not the easy ones. And here's a tough issue. How do we move from knowing what we know, but actually getting it implemented? This knowing-doing gap. And it seems to me that there are some countries that do this better. They act as systems. Atul picked on them, I'm picking on them as well. Scotland, not just because I trained there, but because I think they've found a way to bring together all the different pieces as a whole. If you dig down into successful systems like Scotland, you see they do a couple of things really well. They recognize success and failure and learn from both. I think that's a challenge to us. I'm enjoying my 5th fantastic year here. I love it, my family's here. It feels like a wonderful system that we can work in. But do we know the great things that are happening in every DHB? Do we know the things that have been tried and failed? Or do we keep wastefully repeating those same mistakes again and again and again? Another thing that happens in high-performing systems is they devise solutions. much as you've heard Ian discussing today, coming together as a group, as a system, to actually find the right solutions to the right problems. And then critical within all of that is to have the humility, the discipline, and the teamwork to get colleagues across the entire continuum to think, act, and implement together. Making systems work, whether it's healthcare, education, or any other system, is a key task for all of us. And we shouldn't just think of it in terms of healthcare. As you know, the social determinants of health will make up 80% of the challenge that lies ahead of us. The explosion of knowledge brings an increase in complexity, as Atul has said, and that complexity teaches us that there are different ways of addressing simple problems, complicated problems, or complex issues. But the key is that the complexity we see around us requires a group success, not individual, not one DHB, not another. So yes, we will need pit crews for our patients, but perhaps even more, we will need pit crews for our system. I just want to take you through that and then on to the next, in that basically we're talking about how do we build systems and group success. But if I can now move on just briefly to a second, I'd like to tell you a little personal story that I think captures some of this. On February the 10th, 1994, I was working as a cardiology registrar, moonlighting doing my PhD in genetics in a teaching hospital in Scotland. I was also at the birth of my first son. It was a normal delivery. All looked good. Rapidly, he became yellow. Poor little thing, became very yellow. But no problem, Jonathan. This is common. Let's put him under a light box. So Peter laid there under a light box. But sadly, he got worse and worse. I remember vividly how my son got quieter and quieter, less there. How staff got more and more frenetic, culminating in a priest visiting us to do the last rites on my firstborn. He didn't die. Bloods eventually came in and showed he had a rare genetic condition called Galactosemia. Various things had conspired to give that late diagnosis. Different parts of Scotland had stopped routine testing for galactosemia, but no one was quite sure where had stopped. It was haphazard around the country, a true postcode lottery. Now something happened that has stuck with me ever since that day. It seemed small, but I often think about it. A lovely ITU consultant, who I know well and still know well, pulled out an ancient, dusty textbook, landed with a thump in front of my wife and I, and he looked up and told us our son's future from a source over 20 years old. A lot was wrong with what he told us, as we slowly, painfully discovered over the years after that. No one rang a colleague. No one phoned a friend. No one said this is difficult or rare and looked for some shared learning. Our consultant did what we all do, did what we were all guilty of. He acted alone without sharing. Now that's been burned into my memory and is one of the reasons I do what I do. But it's best said by Atul when he said, we can't know it all. We can't do it all by ourselves. As you reflect on that story, I'd just like to take you through the understanding that we all have around it is that knowledge and our values have changed. Knowledge used to be slow. It used to reside in one expert. It was constant, and the abilities we wanted to see in us, our staff, was courage, self-sufficiency, independence, and autonomy. But knowledge has changed now. It lives and breathes in a network, it moves fast, and it requires humility, sharing, discipline, and teamwork. So, the challenge that we face together. The last 60 years have been fantastic. We've made huge progress in both science and medicine. In fact, in some ways, we have healthcare beyond our wildest dreams now. Think of MRI, CT, PET scanners, the 6,000 drugs that Atul mentioned, many operations. But if we take a step back, we will see some dark clouds on the horizon. Now, those of you who know me know I'm an optimist. We're going to beat all of this, but we have to step back and look, because those dark clouds relate to the fact that we are separate, competitive, We're incentive-driven and target-driven. There's harm, waste, variation, financial constraints on the horizon, if they're not here already. Coming along is an increased demand, increased expectation, and I challenge you that increased inequality and inequity. We have a failure to prevent chronic disease. We don't know what we're going to do about climate change, and all of this is in the context of a knowledge explosion. I would suggest that the story of right now is a variation within our system. Limited capability. I worry about our smaller DHBs that don't have some of the significant resources that those of us in larger DHBs have, and a need to improve faster than at any time in the future when all of those challenges are around us. So the challenge. Don Berwick, a colleague of so many of us, has said, now is the time for leadership. But there is some leadership that gets in the way. He raises some powerful challenges to our current approach. The toxicity of traditional leadership approaches, the victims that we are of the myths that pervade the systems that we work in, sticking to old theories that don't help us in these new times. In most places, myths are in charge. Don says this very eloquently, but let me play back a couple of those ideas, because some of those myths drive fatal positions as we go forward. The idea that incentives, glasses are a struggle here. The idea that incentives, measurement, accountability, markets, or technology will save us. Most people would say no. Technology will speed up poor systems. But the positions that it drives us to that are so challenging are, do we really exist in a system where we believe in competition, which inevitably means that to have winners, we have losers? Who votes to be a loser? That collaboration is naive, and do we really believe that competition builds better bridges? There are some truths, though, that are equally challenging. Cooperation works, but it's really, really hard. And that competition builds waste that we often don't acknowledge. Don isn't alone in this. You can go back 60 plus years and see the architect of much of our quality improvement thinking, and Deming said many great things, but one of the things I want you to focus on is he said there were 3 destroyers of quality, both individual and system quality. Just look at the third one with me for a moment. Competition instead of collaboration, 60 years ago. So, we're moving through the brief reflections, ideas of systems and group success, the ideas we can't do it all, my suggestion that we exist as a bunch of an archipelago of small islands of success with poor and imperfect bridges between us, and the opportunity of what could we do when we're thinking optimistically about the way forward. One thing we know for sure, hope is not a plan. That will not get us to where we need to be. We've been lucky enough to hear from Atul over the weekend for some of us, and again today, and that's a great privilege. And Atul and others have some ideas that we know will help us get through. So I just want to share some of those solutions, but I want you to focus on the main one, which is in the middle. Seek to collaborate, connect people to execute the change we want to see. We're good at thinking about things, we're good at devising the solutions, and I'm absolutely confident that by connecting, we can address all of these challenges that are coming. Because I believe that the answers to each of those challenges exist somewhere in our system. It might be in healthcare, but it might be in other public services or outside our public services. But we have to be brave. We have to take that first step that can feel so frightening. And we have to be prepared for things that might scare us or intimidate us. Scottish link. I think we also need the humility to continually import ideas from elsewhere, whether it's from the grocery industry or whether it's from other industries that we acknowledge but have to take on board really quickly. So let's join up the bright spots. Let's acknowledge all of the good things that are happening in every single health system in our wonderful small country. Let's act together, and join up what's going on in our communities. Let's join up the things that have worked, the things that haven't worked, and actually we connect up our bright spots. But let's make this into a concrete, what shall we do going forward? If you will let me, I would be bold enough to start setting an agenda for all of us in New Zealand. And I think the Health Quality Safety Committee have been leading the charge on this, but I think they need our help to do this even more. So what could we do? Wouldn't it be amazing? Wouldn't it be fantastically exciting to be the best health system in the world at improving? And I think we're the perfect size. We have all of the people, all of the skills, all of the ideas across our health system. So let me suggest, as an optimist, wouldn't it be exciting if we established ourselves as a learning network, that we stopped competing, and let's grow up. Let's get past this tall poppy thing that seems so popular here. Let's stop competing. Let's substitute some science. Let's meet regularly. I mean, what a fantastic occasion this is, but what a great opportunity it is for us to learn and share and reflect and celebrate. Let's get those award ceremonies back. What happened to the idea 5 years ago that we would share our great practice across our DHBs? But no, we'll cut that because it's too expensive to share the great successes. Let's build and support a national system to remove the variation that exists in our practice, a national learning and national improvement network. So, an archipelago, joined up with imperfect bridges and previously supplied and created by the cowboys that we have all been in our independence and our approach to managing knowledge. But there's an opportunity to go forward, and I would just like to finish by reminding us, by saying again, wouldn't it be amazing if we could be the best in the world at improving? If we were the system everybody in the world looked to around improving healthcare, improving health in New Zealand. So my offering, my suggestion, my challenge to us is, let's create that Improve New Zealand network. Let's share our dashboard. Let's build a leadership sharing process. Let's visit each other and actually learn what's working and what's not working. Let's build the collaboratives that the Quality Commission have been driving. Let's do something really important. Let's eradicate something every year. Let's learn faster together. Let's drive this by the front line, for the front line, because the one thing we know is that knowing is not enough. We must collaborate, learn, and do together. Thank you very much.